Welcome to the Deep Dive. This is where we take all that material you've shared, could be articles, research, maybe your own notes, and really zero in on the core insights. The goal is pretty simple. Give you the fast track to being properly informed on something important, pull out maybe some surprising bits, and add just enough context to, keep it interesting. Today, we're diving into something really critical. It's about getting a handle on healthcare quality standards, and maybe even more vital for you personally. What actually happens when those standards meet a high-pressure emergency? Specifically, healthcare referrals. So our mission here is to unpack the key stuff from the sources you sent, help you make sense of these parts of the healthcare puzzle, and maybe feel a bit more prepared if you ever face a situation like this.
Yeah, and that preparedness, it's really two sides of the same coin, isn't it? You kind of need to grasp the big picture, the systems that are supposed to ensure quality, but just as importantly, you need those practical steps. What do you do in that moment, that high-stakes emergency referral situation? So yeah, this deep dive should connect those points for you.
Let's kick things off with that foundation then, making sure healthcare is high quality, that patients are safe. Well, it's not just left up to individual hospitals to figure out. There's specific organizations, bodies, whose whole job is setting standards, checking performance, and assessing how well providers meet those benchmarks.
Okay, and one name that really jumps out in the materials globally is Joint Commission International, JCI. It's flagged as a major leader in this space, right? Healthcare quality, patient safety, been around a while too, something like over 20 years focused on pushing quality improvements across the world. That's right, and their reach is pretty vast. We're talking over 70 countries supporting, I think the figure was, over 1,000 accredited or certified programs. And they've got this network, hundreds of experts, like 600 plus helping them. Their stated mission, it's very clear: enable and affirm the absolute highest standards in healthcare quality and patient safety for everyone.
And looking at what they actually offer, it's quite a lot. They develop these really rigorous international standards. The International Patient Safety Goals get mentioned as a key example. They also have accreditation for hospitals, obviously, but certifications too, for specific things like clinical care programs, even healthcare sustainability, telehealth. And then there's training, advisory stuff too.
Yeah, and what's interesting is this idea, the sources talk about the JCI advantage. It sounds a bit like marketing, maybe, but the core idea is how their expertise helps places achieve what they call highly reliable delivery of care. Yeah. And when you look at the testimonials mentioned, the benefits aren't just on paper. Hospitals report things like, genuinely better teamwork, better communication, also a competitive edge, more community confidence, better risk management, actually reducing risks and fostering this real ground-level culture of patient safety. That seems key.
Right. And the sources also bring up another important player, especially if you're in India, NABH. That's the National Accreditation Board for Hospitals and Healthcare Providers, part of the Quality Council of India, I gather.
Exactly. NABH's job is basically to set up and run accreditation programs specifically for healthcare organizations within India. It's set up to think about consumer needs, set benchmarks for the health industry there. It operates with functional autonomy but gets support from stakeholders, the big aim, creating an ecosystem for quality.
Okay, so if we boil down why accreditation matters, based on this, for the hospital or clinic, it's a way to measure themselves, see where they need to improve.
Right.
And for you, the patient, the whole point is hopefully getting a higher standard of care, safer care, better quality care when you walk through their doors.
Precisely. It's about that assurance, that baseline of quality.
Okay, so that paints the picture of the standards and who sets them. But, how does a hospital actually do this stuff day to day? How do they turn those standards into reality?
Well, that's often where outside help comes in. The sources mentioned consultancies. Supremedic Consultancy Private Limited was one example given. They seem to step in to help hospital owners right from the beginning, basically, in every phase of hospital development, as one source put it, from planning to accreditation.
And the list of things they do shows you the nitty-gritty involved. It's not just abstract ideas. We're talking hospital design, planning, finding, and hiring staff, and specifically implementing quality management systems, which includes, crucially, helping them actually get NABH and NABL accreditation.
Ah, yes, NABL too. Good point. Yeah. That's the National Accreditation Board for Testing and Calibration Laboratories. So making sure the lab tests are up to scratch as well, not just the overall hospital operations.
Makes sense. And the consultancy support goes down to really practical things too, setting up modular operating theaters,
Yeah.
medical gas pipelines, even buying the right medical equipment.
Exactly. So it shows how these organizations get that expert support. It's not just about building the walls, but embedding the processes, the quality checks, the systems needed to actually meet those tough accreditation standards and, run a quality operation consistently, bridging that gap between the policy and the practice.
Okay, now let's shift gears pretty dramatically here. We've got the systems, the standards, but what about when things go wrong fast? When it's urgent, critical? This is where quality isn't just a certificate on the wall, it becomes intensely personal. We're talking about emergency healthcare referrals.
Right. So an emergency referral. Essentially, it's when your doctor or the facility you're at decides you need care they just can't provide right there, right then. So they direct you, the patient, to another place, usually a specialist, or maybe a bigger hospital with more advanced capabilities for more evaluation or treatment.
And the material points to some really common reasons why this might happen in an emergency. Like the place you're at just doesn't have the right specialist. Maybe they don't have a neurologist on hand for a suspected stroke or a cardiologist for a serious heart attack, that kind of thing.
Exactly. Or it could be about equipment or facilities. Maybe you need an ICU bed, a ventilator, and they're all full. Or you need an urgent CT scan, an MRI, and they don't have one. Or it's not available right then. And sometimes, unfortunately, it's just that the facility is completely overwhelmed. Too many patients, not enough capacity. But here's a really, really crucial point from the sources, something to hold on to in that stressful moment. An emergency referral isn't them giving up on you. It's not a rejection. Fundamentally, it's a recommendation. It's the current team saying, to give you the best chance, you need to be somewhere else. It's about getting you the right care.
Okay, that's a vital reframe. So let's unpack this from your perspective, the person experiencing this or helping someone through it. It's incredibly stressful. What are the absolute key things you need to do? Based on the practical advice in these sources, what's the action plan?
Okay, step one. And look, this is probably the hardest one, but it's so important. Try to stay calm. And really listen. I know your head's spinning, but focus on what the doctor or nurse is telling you about why this referral is happening. And ask questions. Ask clarifying questions right away.
Okay, what kind of questions should be top of mind in that immediate, urgent moment?
You need the basics, fast. Ask very directly. Why exactly is this referral necessary? Get the specifics. What's the level of urgency here? How fast do we need to move? And crucially, where specifically should we go next? Get the name of the place.
Right, nailing down the why, how urgent, and where. That makes sense. And here's where the information piece becomes absolutely critical. The sources really hammer this home.
Yes, that brings us straight to step two. Get documentation. Do not leave that first facility without something in writing. A referral letter, a written summary, whatever they can give you. Think of this piece of paper as your passport at the next hospital. It needs to cover the basics. What they think is wrong, preliminary diagnosis, what they've already done, treatment, tests, why they're referring you, how urgent it is, and contact info for the place you're heading to. The advice is crystal clear. Don't depend only on verbal instructions. Get things in writing. It just saves so much vital time and confusion when you arrive at the next stop.
Okay, written referral, no check. Step 3 then seems to be about the actual move, handling the transfer logistics. You can't just jump in a car necessarily.
Definitely not, especially if things are serious. So before leaving, coordinate this carefully. First part, confirm the receiving facility can actually take the patient. Ideally, the sending hospital does this, but if you can, double check. A quick call ahead to make sure they're expecting you, they're ready, they have a bed or the right team available.
Right, capacity check. Then arranging safe transport. This sounds non-negotiable.
Absolutely. If the patient's condition is critical, unstable, you almost certainly need an ambulance. And not just any ambulance, one with the right medical staff and equipment. Make sure it's equipped for the level of care needed, oxygen, paramedics, whatever the doctor says is required. Now, a private car might be okay if and only if the doctor says the patient is stable and it's not immediately life-threatening. But the sources are very clear. Always ask the doctor first about the right way to travel. The transport has to match how sick the patient is.
Okay, transport sorted. Then step 4 kicks in the moment you arrive at the new place. Communication.
Yes. As soon as you get there, you need to be ready to share all that key information. Hand over the referral note immediately. Explain again why you're there. Share any test results you brought. Mention relevant medical history, current medications, vital signs if you know them. You're essentially bridging the information gap so the new team can get up to speed fast and start treatment without delays.
Makes sense. Transferring the knowledge is as important as transferring the patient. And then step 5 covers those really practical things that are easy to forget in the rush.
Exactly. Like insurance. Before you even head to the referred hospital, especially if it's a private one, try to quickly check if your health insurance is accepted there. Is it in your network? Particularly important if you're looking for cashless treatment, which is common in private or corporate hospitals. That can save a lot of stress later.
Good point. And also, gathering all the paperwork before you leave facility number 1. You mentioned the referral note. What else?
Yeah, grab previous test reports if you have them, the patient's ID proof, definitely your insurance card or details. And don't forget, you might need to inform your insurance company or your TPA, that's the third-party administrator, the company that often handles claims about the hospitalization. Check your policy requirements on that.
Right, so get your documents in order. And then once you've arrived, hand it over the info. What should you generally expect?
Well, the process will usually start with the emergency team doing their own initial assessment. They might need to run more tests, maybe repeat some. Then the relevant specialists will likely get involved for diagnosis and figuring out the treatment plan. And the sources emphasize, don't be afraid to ask questions. Ask the staff to explain the plan, the likely timeline. It helps manage anxiety and keeps you in the loop.
That's good advice. Now, stepping back a bit, how does this urgent referral process connect to the bigger picture of quality and being prepared?
Well, the sources link it back. They mention things like pre-hospital care and patient education being part of a quality system. This includes, for example, healthcare providers instructing families on why prompt action is needed if a referral is suggested, or guiding them on things not to do in certain emergencies like don't eat or drink if surgery might be needed, or minimize exertion with heart issues, and also broader public education. Teaching people to recognize early warning signs of emergencies, basic first aid, so they know when to seek help and what initial steps to take. That's part of the ecosystem, too.
And on the provider side, you mentioned documentation earlier. The material stresses they need to assess if the referral is truly appropriate and urgent, and write down why. That sounds like part of their quality obligation, too.
Absolutely. It shows they're following a standard of care, making considered decisions, not just passing the buck. It's about accountability and ensuring the referral is justified and in the patient's best interest.
Okay, here's a really practical takeaway for you, the listener, from the sources. Something you can do before any emergency happens.
Yeah, this is a great tip. Know your local hospital landscape. The suggestion is to create your own personal hospital map. Identify maybe 2 or 3 hospitals within a reasonable driving distance, say 30, 45 minutes. Include both government and private options if you can. Jot down their emergency contact numbers. Maybe even note the best entrance for the ER. Doing that little bit of homework now could save incredibly precious minutes if you ever face a crisis.
That's really actionable. The sources also kind of summarize the referral process with some clear DOs and don'ts.
They do. The DOs are stay calm as much as possible. Cooperate with the medical teams. Ask those clarifying questions. Do get that written documentation. Try to have a family member accompany the patient. Use helplines if you're really unsure about something.
And
Don't delay acting on the referral advice. Don't leave the first facility without that written summary. Don't rely only on verbal instructions for critical details. And don't forget your essential documents, ID, insurance, reports.
Right. Got it.
Look, the bottom line message about these emergency referrals, it really bears repeating. They're done to get the patient the right care, the best possible care in that situation. It's not about shifting responsibility. Acting fast, asking the right things, getting that paperwork, being ready to move that combination can genuinely save time and potentially save lives, as one source put it really well. In a crisis, don't waste time feeling confused. Ask, act, and move.
So, thinking about everything we've unpacked, what's the main takeaway here? It feels like understanding those big systems, the standards from bodies like JCI and NABH, that provides the backdrop. But then having this really clear step-by-step guide for navigating a critical moment, like an emergency referral, that's where the knowledge becomes truly powerful for you personally.
I think that's exactly right. It shows how healthcare quality isn't just one thing. It's the interplay between the robust systems and standards that organizations aim for and the informed, prepared actions that individuals, patients, families working with the system take, especially when time is absolutely critical and clarity is everything.
So maybe a final thought for you to ponder after this deep dive. How does knowing about these efforts, the big picture global and national quality drives, and also knowing the very specific granular steps of handling an emergency referral. How does that change how you think about being ready, both in terms of what you expect from healthcare facilities, but also your own personal readiness for a potential health crisis? What part of all this information really stands out for you right now?